is Dr. Sarada Midapali. What's your name?
My name's Alex.
Nice to meet you, Alex. So what brings you in today?
So I've been seeing some discoloration in my left toe, and it's not painful or anything, but it has been spreading the past few days. Nothing in particular really caused it, but it is concerning now that it's spreading.
Okay, so you don't feel any pain right now, but if I were to touch it or put pressure on it, do you feel pain?
No.
Okay. So how long ago did this happen?
I'd say about 3 months ago it showed up.
Okay. And it's been then getting progressively worse? Or
Yes,
spreading?
it's been spreading over my toe.
Okay. Well, now I'm going to ask you a few questions about yourself, Alex. Do you have any significant past medical history that have happened to you as a child or adult?
No.
Okay. Are you current on all your immunizations?
Yes. Yes, ma'am.
All right. Are you on any current medications?
I am on one for high blood pressure. It's in my family. I think it's called Dilovan.
Okay. All right. And then are there any allergies that you have?
No, I do not have allergies.
Okay. In the last 6 months to a year, have you had any blood transfusions?
No.
All right. So patient seems alert and aware. I'm going to ask you now a little bit about your day-to-day life. Do you work, Alex?
Yes, I do work at a construction site.
Okay. And do you exercise?
Outside of work? No, not really.
All right. Have you traveled in the last 6 months to a year?
No.
Okay. Do you drink?
I do occasionally, really only on the weekends.
Okay. And then do you smoke?
Yes, I do. I smoke about a pack a day.
Okay. Now, do you have any recreational drug use?
No.
All right. And you're smoking, how long have you been smoking?
I've been smoking for the past 3 years.
Okay. And then could you tell me a little bit about your diet?
I'm not really particular about my diet. I don't really cook at home, too much time at work, so I usually go to eat out. I'm not very selective. I do tend to go to fast food places though.
Okay. Now, do you have any pets in your home?
No.
Okay. Now, are you married?
No.
All right. Can you tell me a little bit about your sleep patterns? How often do you sleep? Do you sleep daily?
I go to sleep around the same time every day, 9 to 10. I get about 6 to 8 hours of sleep. I don't really have any troubles falling asleep or staying asleep.
Okay. So you told me you're not married, but are you in a relationship?
No.
All right. Are you sexually active?
Yes.
And do you practice safe sex?
Yes.
Okay, let's talk a little bit about your family medical history. Are there any significant events or conditions that any of your immediate family members have had?
I mean, as I said earlier, in my family there's high blood pressure, my mom being one of them. She's 52. On top of having high blood pressure, she also has Alzheimer's and dementia. And my father had recently passed away. He had a heart attack, which is what led him to die.
Okay, my condolences for your father passing.
Thank you.
Now I'm going to start your medical exam. So we're going to examine your feet and your lower extremities. So first I'm going to check your pulses. I'm going to check your dorsalis pedal pulse. Next, I'm going to check your posterior tibial pulse. And then I'm going to look at your pulses in the popliteal area. All right, so your pulses are within normal range. They're showing 2 out of 4. Next, I'm going to look at your skin elasticity. So your skin elasticity is showing in normal range. Now I'm going to check the temperature of your skin. Warm to warm, within normal range. I'm going to look at your capillary fill time. All right, the capillary fill time are all under 3 seconds, so within normal range. Next, I'm just checking your skin. You have good smooth skin, normal hair patterns. I'm looking at lesions, calluses, or any wounds. I'm going to be checking behind your leg as well. So everything looks good, everything within normal range. A little few calluses here and there, but it's to be expected sometimes in your line of work. Next, I'm going to be doing a muscular skeletal exam. Okay, so I'm going to check for muscle tone. So I'm going to ask you, I'm going to put my hands on the sides of your feet. I'm going to ask you to push out. Okay, I want you to push in. I want you to pull back. Okay, I want you to push against. All right, so you have good muscle tone. Now, we're going to check the range of motion for your first ray or your big toe. All right, I'm going to check your mid-tarsal joint range of motion. Now, I'm going to look at your subtalar joint. I'm going to put it in neutral. All right, and then check the range of motion. You have good range of motion. I'm going to do the same thing for your other foot. Mid-tarsal. Okay, we're putting this in neutral. All right, you have good range of motion for your ankle joint. Now, I'm going to ask you to bend your knee. Okay. I'm going to put your subtalar joint in neutral. I'm going to check your range of motion. Not as much range of motion, it's a little bit tight, so you have a little equinus. A little tight there as well. Other than that, everything is in normal range. Now, I am going to do the monofilament test. I'm going to ask you to close your eyes. And then when you feel, this is what it'll feel like. So when you feel this touching the bottom of your foot, say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
All right. So everything is in the normal range. Next, we're gonna do your proprioception. So what I'm gonna ask you to do is I'm gonna ask you to close your eyes, and I'm gonna lift a toe, and you're gonna tell me which side of the leg it is, and if I'm going up or down. Okay?
What do you mean by which side of the leg?
Is it your right leg, right toe, or left toe?
Okay.
And then, am I moving it up or am I pushing it down?
My right toe, pushing it up. My right ring toe and pinky toe, pushing it down. My left big toe, pushing it down. My left pinky toe, pushing it up.
All right. So everything is within normal range there. Next, I am going to use a tuning fork here. And I'm going to have you close your eyes. I'm going to bring the tuning fork to the top of your foot. When you feel it stop vibrating, then just say stop. So please close your eyes.
I don't even feel it vibrating. Stop.
Okay.
Stop.
All right. So everything came within normal range. Next, I'm going to do the sharp and dull test. Okay. So this is the dull, and this is sharp. So I'm going to have you close your eyes. And then when you feel it, please tell me, do you feel sharp or if you feel dull?
Dull. Dull. Sharp. Sharp. Dull. Dull. Dull.
so everything is within normal range. Next, what I'm going to ask you to do is, next I'm going to test your Babinski reflex, okay? All right, all within normal range. Now I'm going to ask you to sit in this chair here so that I can test your knee reflex and your Achilles tendon reflex. All right, I'm going to test your Achilles tendon. Okay. All right, so everything's within normal range. So after examining you today and looking at the discoloration of your toe, I think that perhaps you may have what we call longitudinal melanechia, which all it really means is a discoloration of the toenail. And it could be, it's common when a toe experiences traumatic events, so perhaps in your construction work, there might have been a time you bumped it somewhere or something fell on it you weren't aware of. Or it's actually common in people of African American descent for these things to come up. So it is benign, but just to be on the safe side, we would like to do a biopsy and then perhaps do an x-ray to rule out melanoma, which would be the worst case scenario. So we're going to schedule in a nail biopsy for you as well as an x-ray, and then we'll have a follow-up appointment in 2 weeks. So then we can discuss the results.
Okay, that sounds good.